of Parliament for Bunkprugu in the Northeast region, Abednego Bandin, has expressed worry about the delay in payment of the arrears of the National Health Insurance Scheme owed to the District Health Center. According to the District Health Authorities, services rendered under the National Health Insurance Services haven't been paid for several months to date. The MP says the non-payment of these accumulated debts is hindering the effort to ensure the provision of quality healthcare services to the people. Speaking after donating several motorbikes to the District Health Directorate, the MP demands the immediate settlement of the NHIS arrears to improve service delivery at the facility.
I want to thank you, Director, and I hereby hand over to you the 4 motorbikes for your use. So please use it judiciously. Thank you.
The donation of these 4 motorbikes, according to the Member of Parliament, is in response to the request for assistance from the District Health Directorate. He said the Directorate had requested from him means of transport to assist in the extension of healthcare services to residents in far-flung communities in the district, especially as the rains have begun. The Bunkprugu Nakpanduri district is one of the deprived districts without a hospital and where the provision of primary healthcare services is being hampered by bad roads and inadequate staff and logistics. Receiving the donation at the health facility in Nakpanduri, the District Health Director Awuni Mbabila bemoaned the numerous challenges confronting the Health Directorate, but added that the motorbikes provided would contribute to addressing the challenges.
It's just to make health service accessible to the doorsteps of the people. Some of the areas, vehicles and others cannot move in there, and so this is there to ensure that. And currently, we know that Bunkprugu is one of the seriously deprived in this region, and so this one comes to at least help us to improve upon the living conditions of the people.
The Health Director also expressed concern about the impact of the delay in getting payment for services rendered under the National Health Insurance Scheme. He implied that the situation contributes to the constant shortages of medical supplies and the poor service delivery at the facility.
As of now, they are owing us 11, 12, whatever month, they are paying us 2 months. You know, we even spoke about that. Here's the case. Health insurance is owing you a match. They pay you 2 months and you have to pay 70% to defray your debts. How much? So there's a lot of, and when they bring the drugs, the component you have even requested is not even enough. And then you have to wait for the next 3 months. And those days, what happens is that when you request for the drugs at the regional medical stores and you go, the quantity they can't get for you, they give you a certificate to go outside and buy. And so if they don't give you the certificate, and then I will not want to go outside and buy, and tomorrow they drag me to public accountant. So sometimes we have other issues, and so the challenges are there.
The Member of Parliament, speaking after donating the motorbike, said despite the delay in payment of the statutory funds by the government, he will continue his efforts to ensure all public institutions in the district are adequately retooled to effectively serve the people.
The releases are no longer coming regularly as it used to be. Talk about common fund, it doesn't come regularly. Talk about gate fund, it doesn't come regularly. The gate fund that came last year was what I used to acquire mono desks for the district education directorate. So in education and health, I will not relent in ensuring that we use it to develop our people.
He also described the reports about the non-payment of the NHIS claims at the health facility as worrying, and thus joined the call for the settlement of all arrears.
Quick releases of their NHI funds, you know, because when I came as the MP, I had to chase the Health Insurance Authority. So cumulatively, I had to lobby them to pay that money under the retired Director General. I'm yet to meet with the new Director General. I understand that they have not been paying them. In fact, my intervention in 2001 actually made them to pay all, including NIO, right? There were some facilities in NIO that they were also owing. So it's important that the NHI at the national level pay and pay quickly so that they can help the local or districts health directorates across the country, particularly Bunkprugu, to continue with their work.
The Health Directorate expressed gratitude to the Member of Parliament and assured that the motorbikes will be properly utilized and maintained. Elias Sotanko reporting from Nakpanduri for Joy News.